A stroke is an injury to the brain, and the injury is caused from an interruption of blood flow suddenly. The majority of strokes are called ischemic stroke. Ischemic or ischemia means reduction in blood flow. So suddenly, if the brain's not getting enough blood flow, maybe the blood vessel is blocked, maybe a little clot went up to the brain. So that's going to cause an ischemic stroke from an interruption of blood flow. And that happens about 80% of the time. 20% of the time is hemorrhagic. So hemorrhage means bleeding. So again, if you think of a blood vessel full of blood in the brain, all of a sudden that blood vessel is going to rupture, spill, and allow blood to settle in the brain. The symptoms are abrupt. There can be weakness on one side, numbness on one side, problems with speech, problems with vision, problems with walking, where almost they're walking as if they're drunk. If those symptoms happen suddenly, you need to call 911 immediately in order to go to the closest emergency room. Ischemic strokes are treated differently than hemorrhagic stroke. We try to give a medicine called TPA, which is essentially a thrombolytic. Thrombus clot, lytic to break up. So if we think that ischemic strokes are from not enough blood flow getting to the brain, we know that TPA is a very strong blood thinner that improves blood flow to the brain. But we also want to know that someone's not having any bleeding in the brain, because why would you give a blood thinner in that case? In addition, we're going to be very detailed in asking the patient, has there been any bleeding history? Are they on blood thinners? Because that would also change our management and whether they're eligible to have a very strong blood thinner in acute stroke. For hemorrhagic stroke, it's different in terms of acute treatment. So since we're not going to give a blood thinner when somebody's bleeding in the brain, really what we have to do is support them through the injury. So there are many things that we need to do in terms of medication, control of blood pressure, etc., to try to limit the degree of swelling so people don't get worse. In stroke treatment, we say time is brain. And what we mean by that is that every moment that goes by, there are 1 million brain cells that die, right? And so if that continues over and over again, you know that the degree of brain that's injured is going to be considerable. Come in right away, we can really try to shorten that damage and therefore the disability that someone might have after that.